So the differential diagnosis of upper abdominal pain in a 50-year-old female, like we said, is broad. It can be anywhere from peptic ulcer disease, so it's important to ask if the patient has pain after eating or the pain gets better after food, which can be suggestive of either a gastric ulcer or a duodenal ulcer. It can simply be an episode of gastritis, so it's important to differentiate if the pain is more related to heartburn or if it's actual dull, achy, sharp pain. Pain in the epigastric region can also be related to the biliary tree. So if the patient gets the pain after eating a fatty meal, then this is suggestive of acute cholecystitis. Other questions that are important to ask the patient is that if they've noticed that they've had any yellowish discoloration in their skin, in their eyes, or when the pain started, or if it's gone away. The differential can also be very wide in terms of the biliary tree itself. It can be cholecystitis, it can be choledocholythitis, which is a common bile duct stone, or it can be pancreatitis. So now that we know all this information, what blood work should we get and what imaging would be the first choice? So starting with a basic CBC and the BMP is important, but it's also important to get a set of liver enzymes such as AST, ALT, and alkaline phosphatase, GGT, as well as liver function tests such as a bilirubin, total and direct, as well as an albumin level and an INR. And amylase and the lipase can help us rule out acute pancreatitis. In terms of imaging, we can always start with the right upper quadrant ultrasound to look at the gallbladder, and then proceed with a CT scan of the abdomen and pelvis to look at the rest of the organs. If we're thinking about peptic ulcer disease, an upper endoscopy would be important. However, this particular patient did not have any bloody emesis, so I think focusing on the ultrasound and the CT scan would be the first way to go.